right, let's go.
Hello, everyone. Welcome to Urban Renal Talk with Tamika.
And Steve, hello everyone. Thanks for joining us.
Yes, tonight we have an awesome guest, Mr. Rob Robertson. He'll be telling us about his amazing journey to donate his kidneys and also be sharing with us information on Forever Outdoors. Hi,
Absolutely.
Rob. Thank you.
Yeah,
Thank you for
thanks for
joining us.
Hello, how are y'all today?
pretty good, pretty good. I know
Well,
last week we had a little technical difficulties, and we're looking forward to having a great show tonight and hearing your
yeah,
amazing story.
yeah.
Yes, sir.
So, how's it going? Where you at, Rob?
I'm in Mississippi.
Wow, wow. So, tell us your journey again.
Well, okay. Well, born in Mississippi. I was a firefighter in Starkville, Mississippi, and my sister moved out to Kansas, and I'm a huge outdoorsman. And anyway, I got to go into Kansas hunting big whitetail deer, and I did that for many years, and got to seeing all these turkeys. And I decided, well, I'm going to try my luck at turkey hunting. Well, the second year I ever turkey hunted in Kansas, or anywhere actually, I killed a state record turkey as number 7 in the world.
Wow, number 7. Wow.
Number 7 in the
It's a
world.
big,
So there's 4 different kinds of turkeys. It's called the Grand Slam, and it's a big challenge. You got to travel all over the country to get them. And the next year, I went out to Western Kansas and knocked on a farmer's door, and we talked about 5 minutes in his doorway, and he gave me permission to hunt. And I didn't see him again for 3 years later. I'm knocking on his door again. This time I asked could I pitch a tent in his yard, and he invites me to stay in his house, but I'm an outdoorsman, so I pitch a tent 15 feet out his back door for 5 days, and I'm hunting, he's working, and we have a meal or two together, and he lets me take a shower, and uh, he's doing home dialysis this time while I'm there. So when I left, we stayed in contact, and the next year I got tested and was a match and donated him a kidney.
wow.
Well, did how did the conversation come out about you donating your kidney to this gentleman?
Well, I mean, he was doing home dialysis, and he was looking for a match, and I just felt like it was. I wasn't even an organ donor on my driver's license before. I mean, I thought about it, but I just felt that it was, if I could help him, it was gonna be, and
One,
it
thanks.
Wow.
so.
So, when you seen him on dialysis, did you know anything about what dialysis was?
I mean, was a firefighter EMT, and I actually had a cousin die many years ago from kidney failure back in the probably in the early '80s or so. But uh, so I've been around dialysis patients some through my work and all. So
Okay.
Before you met guy you donated your kidney to, you've been around it before then or after?
I mean, just through my job. I mean, I not that much, but I mean, you run across diabetic patients and stuff
Hey,
through
you were a
being.
firefighter, weren't you?
Yep.
Yes, sir.
Wow, wow. So,
So,
were you a firefighter when you gave your kidney?
I was. I was.
How did your colleagues? What do your colleagues think about that?
Well, it was a long story. My fire chief actually tried to talk me out of doing it, but I mean, I didn't have the best support from my colleagues at all. I would say, but
Okay,
you
okay.
know,
Can I ask you, was it because of the race of the gentleman you donated your kidney to, or was
I
it concerning your health?
I mean, they were just couldn't understand why I'd do this for somebody that I didn't even know. So it was going to put a strain on their department, and they didn't see the big picture. And
Right.
I never talked to my fire chief again after that. I mean, it just strained my relationship with him, and eventually he retired. But I quit a couple years ago. I've started an organization called Forever Outdoors, my love of the outdoors, and me donating a kidney, where we promote organ donation and take veterans and kids and hunting and fishing and outdoor adventures, just anywhere I can make things happen.
How did you
So
start that, Rob?
Well, a friend of mine had heard on a radio about this turkey hunt. They were needing some guides, and he gave me their number, and I went down there and helped out on a veteran hunt. And I spawned this idea about Forever Outdoors, and where I could promote organ donation and take veterans and kids, cancer survivors, just all kinds of different people, not just hunting and fishing, but all kinds of outdoor adventures. And we took several people out to Gill's place out in western Kansas. Our first hunt we took 5 wounded warriors from Mississippi out to Nicodemus, Kansas, and had an awesome time. And we had several hunts out there. Uh,
so Rob, was it a hard process to go in there and donate your kidney? Like, did they put you through lots of tests?
well, when I came home after I left there from the 5 days, and I decided to get tested, he lived in Kansas and I lived in Mississippi, so I called and told them I wanted to get tested, and they sent me a package of some vials. And I went to my doctor, and they drew a few vials of blood, and I sent it back. And they initially made the match from that. And then after that, I had to go to Kansas, and had to go through like 2 days of strenuous testing and before the transplant. And then we did our transplant, and it was pretty easy, I would say.
Okay, so I'm gonna just let everyone know that the person you donated your kidney to did pass away last year. Actually, it'll be a year in September.
Gil,
Yeah.
he passed away. Yeah, I think it was. I'm not sure. It was last October, I think, right around then.
Oh,
Almost 5 extra years. I'm glad I was able to give him that he wasn't hooked up to a machine. And
right.
yeah.
So
So,
basically,
Rob, I'm sorry, Tamika. Go ahead.
Forever Outdoors is something that you and Gil started to help cancer patients, that renal patients, children, veterans have a place where they can be outdoors and enjoy it.
Yes. And I'm
Okay.
currently
Oh,
wanting to build I have a house here in Mississippi, and I'm wanting to turn it into a lodge and use it as a base. We've done adventures all the way
right.
from Washington State all the way to Florida. We've helped people, you know, and I encourage people to be host if they have something they want to share with somebody, that, say, hey, come and enjoy this place with us. It doesn't have to be, it can be as simple as that, just sharing a place or fishing trip or hunting trip with somebody that won't get to do it normally.
Right. Yes, one that gets a chance to second life too. Go ahead, Steve, with your question. I'm
So,
sorry.
Rob, who pays for that? Do you have
Well,
sponsors?
I don't. I don't. Our first trip we did to Kansas, we took 5 guys out there, and I raised money and paid for everything. And I've paid for some trips through my own, but I try to network and do it where it don't cost much money, but you know, I just have a desire to help others. I quit my job a couple years as a firefighter. Phil guys lead me on this mission with Forever Outdoors to if I when I started Forever Outdoors, if one person signed up to be an organ donor because of me, I didn't even have to know I was a success. And now through our page, you can sign up, and for the last 3 years, we've signed up over 9,000 people to be organ donors.
Awesome.
That's
Awesome.
awesome. That's
Has
awesome.
Gil family contacted you since his passing?
Uh, I've been I've been around his family some. They've actually had to sell his farm off, and it's been tough on them and losing the family farm that's been in the generations through all this time. But and I've had folks. We haven't brought up that comment, but Gil, I'm a white guy from Mississippi, and Gil was a black farmer from Western Kansas, and
Right. The reason
he,
why the reason why I didn't bring it up because though to some it's important, to others race really doesn't matter.
no, Dad.
Race doesn't matter, especially when you're given life.
Yeah.
You know,
And it's just a God thing. I mean, Gil's great grandfather was born a slave here in Mississippi and became a buffalo, went to Kansas and became a buffalo soldier. It's just amazing how things work out. And, it doesn't matter what color you are. It's just about helping somebody. And, uh,
exactly. Exactly. That's why I didn't bring it up that Gil was African American male, because it really doesn't even matter. For some people, like I said, it does, but race is just like color. Your color is just the outside of you. That's it. It's all of what's inside of you that really matters. And you being who you are and donating a kidney, his race doesn't even matter.
Exactly. You're right, Tamika. And the reason why I asked Rob the question with his fire chief because, Mississippi, has a history of slavery by being
Right.
in the South, and so I just wondered if that played any part with your colleagues not giving you the full support of saving another person's life.
And you know what, Steve? It probably did, but they weren't going to say anything, you know, um, because when certain things happen, race goes over people's mind when it really should. And if you're helping someone, you're helping them because you want to, not because the color of their skin.
Absolutely.
If people really stop looking at that and just help people just because they want to help them, it'll be more help out here and maybe even more organs being transplanted because they're not looking at who that kidney is going to. If it's
Absolutely.
going to a black man, if it's going to a white man, if it's going to an Asian man, it doesn't matter.
Absolutely. Absolutely. So, Rob, at Forever Outdoors, what do you actually need to, bring it to full circle?
well, all this hard work, my house is paid for in Mississippi. I have a pretty nice place, but I want to be able to house handicapped people for a hunt for every how many days, and I need to build a place for that lodging, and I
Mhm.
want to build a nice outdoor pavilion area to have meals and have a fireplace and just forever outdoors. I came up with that name is because I'm always outside. If the weather's pretty, I mean, I'd live outside if I didn't have to worry about bugs or the weather. So forever outdoors is about spending time outside. So,
Do,
uh,
do you know how to cook?
I'm a grill man. I can cook I can do pretty good on the grill.
Yeah, because I was wondering if someone decided to visit your farm or your place, how would the accommodations as far as the meals go?
Do what?
How would
I mean,
accommodations for meals? If someone were to come in, wanted to come to your place and stay, say for the weekend, would they be
as
responsible for their own meals?
you talking about when we, what I'm trying to do with Forever Outdoors when I bring people there?
Yes.
No, I mean, no. As once they get there, I mean, everything should be provided for. I mean, I don't know how, but I'll provide them a place to stay, place to hunt, and they just got to get there from
Right.
wherever, you know.
So in the next couple of weeks, Forever Outdoor will be having a fundraiser. We're asking if everyone could help donate $1 to bring this to life. It'll be advertised on our page and on the Forever Outdoor page. So everyone, please look out for it. Thank you.
Absolutely. We need to see that happen, Rob, because there's a lot of people out there who I get would benefit from a place like yours. Maybe a 2-3 day retreat or getaway, just to get away from the everyday norm.
Right.
Absolutely.
Right. And then, you can link up with some hospitals and maybe they'll also help bring people in. So helping this come together will also have to do with networking too. I know a lot of hospitals, veteran centers, you could visit them and pitch your idea to them, and they'll also probably help you too.
Yeah, there's absolutely no shortage of people to help. That's for sure. It's just a shortage of people making it happen. So, but we're gonna get
And it's
there.
right, and especially needed for children and veterans because a lot of times children aren't even exposed to the outdoors today. And then the veterans miss the outdoors, so you can help two people with one stone.
Absolutely. So, Rob, how did tell us how did the conversation go between you and Gil when you told him you wanted to donate? How did that conversation go?
Well, I mean, I guess that he had a lot of people that said they would. Somebody tell you they were going to do something and they don't follow through. And I guess he thought I wouldn't follow through. And I got tested, and actually, I sent him a text saying that I was a match, and he called me. And anyway, he was pretty shook up. And even when I went out there for before the transplant, right before, we had the transplant scheduled and everything, and like the Sunday before we were supposed to go to Kansas City for our pre-op, I was out hunting in the field, pheasant hunting, and Gil was in church, and he actually got a call. He had his phone off. They had him a kidney. When he found out, they said they done give it to somebody else because he didn't have his phone on. Well, they called again later that night, like 1 o'clock in the morning, and said that you weren't a match anyway. But that day, I mean, I told him, kind of shook me up, like, all right, we got this already, So uh, this
Wow.
God has worked through this so many times that the original, when I was on the operating table, I found out later that the original doctor that did the first successful kidney transplant passed away while I was on the operating table. A pioneer of
Wow.
being where I was at on that day. So it's just so many God things, and I don't do what I do for money, and I wish I didn't have to make money, and it's not about that, but I gotta. If I had people behind me, I could reach a whole lot more people.
Right.
We've,
And you
you
will.
know,
And you will. You know what I learned is if you want something out of life, you have to speak it into existence. Of course, you have to do action too, but speak what you want into existence and it will happen. So we have a question from a viewer. Dawn wants to know, how did you feel afterwards? after you donated your kidney?
You know, I mean, I don't know. I mean, I didn't feel any different physically. I was out of the hospital in 4 days. Uh, I worked at the fire department, so I had a physically demanding job, but because I had time off, I took off for like 3 months. But a normal person with a not so physical job could actually be back at work in like a couple of weeks,
Right.
you
How do
know.
you feel now about your decision?
I mean, I feel, I gave Gil 5 extra years of life, and I always, I'm sad that he's gone, but, he's in a better place and he has had 5 extra years of life. I mean, what is that worth?
Yeah. Yeah. Some people don't even have that. Um, did you did you did you incur any charges for your gift? Like, was there a medical bill you had to pay off or anything?
I got bills, but his insurance was supposed to cover. I just had to forward my bills to them. But also, there's grant money out there that helps pay for travel expenses and hotel. I mean, I didn't have money to come out of my pocket to pay for those expensive. I can't remember how much it was. Maybe $5,000 that they can use for up to the 2 years expenses on your return follow up visit. So they pay for,
Oh,
but they pay for travel, and you have to apply for it ahead of time and let them know. But paid mileage, hotel room, all that
okay.
stuff.
And his insurance paid for this?
No, that's a grant
It's a grant? Wow. I
money
didn't
that
know
there's a grant money that is pretty easy to get that you just apply for it and it'll pay for travel expenses, up to $5,000. I'm thinking.
that. Okay, wow. I didn't even know that. That is awesome. That is awesome. So they don't have to come out their pocket or
I
they're
mean,
doing
I didn't even do a lot of. I did no research on donating a kidney. I just knew I was meant to do it, and
because
even though I've had a lot of folks say, "Well, what if this, that, or the other? What happens if you need a kidney?" Well, if I need a kidney, I'll be provided for, and
that's
but
right.
you go to the top of the list if you ever need a kidney. That's what I've been told, that you got 6 months. If you donated a kidney, they put you as a priority to
Wow.
get you a kidney.
I did not know that. That is, see, this is the information that people need to know when it comes to donating kidneys. Because I think a lot of times people start getting scared. Well, what if something happened to happened to mine? What's going to happen? Or
Absolutely. Absolutely.
if more education was out there, like the information that you're giving us, more people will want to help if they know that they go to the top of the list.
Yeah.
I commend you. Thank you. I don't even know Gil, but thank you. You know,
And
more people.
Gil, he lost his bladder 2 years after his transplant. And he almost, like, he lived in western Kansas, and right after we had our transplant, Monday after Thanksgiving, and they had a bad snowstorm, and he was without his anti-rejection medicine for like 4 or 5 days, and that's like a month after the transplant. He almost lost his kidney then because he didn't have his anti-rejection medicine, because they kept on saying it was on the way and it's on the way, and he had to go back in the hospital and was on chemo for a couple weeks, like 2 months after the transplant, and then 2 years later he lost his bladder to cancer, and eventually cancer got the best of him. But his
Mm.
kidney kicked his kidney kicked tail through all that, and he nicknamed his kidney Mississippi.
Oh, Oh, that's nice. That's nice. So, what would you say to someone that was considering donating a kidney? What would you say to them?
I mean, if you're eligible to donate a kidney, I mean, it's you're gonna be pretty healthy. I mean, they put you through the rigorous of uh, so you got to be pretty healthy. Uh, I mean, it's a great feeling to be able to say, you know, I have folks all the time saying, "Oh, you're a hero." I mean, I don't feel like a hero. I just, if I was in that situation, I couldn't be hooked up. I wouldn't want to be hooked up to a machine. I couldn't. It wouldn't allow me to do the things that I love to do, and I just thought I could help, and I was able to help, and
So Rob, this made the news.
yeah, it's been in the news quite a bit. I mean, I've traveled all over promoting organ donation. A few years ago, the governor of Kansas flew me out to Kansas and did a press conference on mine and Gil's story, and it made national news that next day. And everybody thinks that, I mean, it's a good story, but I need it to be more than a good story. It's just folks can help. I mean, everybody seems to think that they got to have deep pockets, this, that, other to help somebody, but you don't. I mean, I don't have a job right now and I'm struggling, but I mean, I still help people every day. I continue to sign people up every day to be organ donors. And I took a kid fishing the other day, and he lost his dad. I used to work with his dad, and his dad was murdered when he was 5 years old, and he never really knew him, and he's been
Mm.
kind of down. And I took him fishing, and we never hung around each other. I mean, he's 21-year-old kid, and he sent me a text message the other day that said he signed up to be an organ donor because of that fishing trip, and just me sharing my story with him, and that was
Yeah,
awesome.
yeah. I think those that can, I can't be a organ donor because I have scored kidneys, but for those that can, they really should become an organ donor.
And even with Gil and all his medical problems he had,
Mhm.
uh, he was able to donate his eyes when he passed away. Somebody was able to get Gil's eyes. So I hear a
Wow.
lot of people say, "Well, ain't nothing on me they can want or take," but you just never know. There's so much stuff out there. I mean, it's not just organs. I mean,
Right.
it's
That's
all
because
kinds
they're
of
not
stuff.
educated. That's why that person said because they're not educated. They don't know what being an organ donation, sorry, being an organ donor really is. What you really can give. It's just not your kidneys. It's just not your what, liver, heart. You can save 9 lives.
Yeah, I think it's 8.
8. I
Yeah,
just read something that said 9. We
I
gonna
have
I've
double check.
heard it.
some
I've
information.
heard it's 8, but I mean, there's so much more than that. I've heard that many people have been touched. I mean, hundreds of people have been touched by one person being an organ donor. But that
I,
just multiply that by the family members. People go on to have kids and grandkids, and I just connected with a lady out in, I think she's in North Carolina or South Carolina. She was the first kidney donor in that state 50 years ago. This December, she donated her kidney to her brother, and
wow.
she had a sister that also received a kidney, and they're both deceased now. But Miss Velma, she donated her kidney 50 years ago, first one in the state of South Carolina or North Carolina, and actually she sent me a small donation the other day to helping my cause with Forever Outdoors.
Wow,
Okay.
wow. So where can people, if they wanted to send you donations to help you fund this, where could they send it to?
Well, I mean, I really don't have an account set up, but we did some. You can send money through Messenger on Facebook now, and it is really simple. And we get this GoFundMe page set up. Everybody could donate through there, but just like it's really simple to send money through the Facebook Messenger, and
Yeah,
that's how.
a lot of people, you may want to kind of reconsider Facebook Messenger because it's a lot of hacking on Facebook Messenger, and I don't think a lot of people are going to feel comfortable
Yeah,
through Facebook. That's what I experienced
yeah.
as
Well,
well.
I don't know what the best way to do finances is, set up that kind of stuff, but
Do you have Cash App?
The next hmm? the
do
next
what?
couple we'll be working on that. The next couple of weeks we'll be having a fundraiser and creating the group or the page for you for the GoFundMe. So you and I will be working together so we can get this GoFundMe off the ground and you can start creating the forever outdoors that you want.
Awesome.
Yeah. So we're just
Thank you.
asking $1 from all of the people that's on your page. I think that's what you have 50,000 people on your page.
Over 58,000.
Over 58,000. And then there's another option of PayPal, Cash App. There's so many different options. So I'll be working with you closely to get this running. Okay.
Okay, awesome. Thank you.
So if there anyone else that would like to help Rob, you could go to his Forever Outdoor page and send him a message. He needs all the help that he can get to try to bring Forever Outdoors together the way that he and Gil visioned it. I'm sorry, I've been up since like 2:45 this morning.
And
Yes.
everybody go like our page and invite all your friends. I talk to every single person that likes our page. We haven't paid for advertisement. So I've carried on a conversation with 58,000 people and you got 1,000 friends, you go invite those 1,000 friends, and that's how it just can snowball so fast where Forever Outdoors and organ donation can go.
So have you ever thought about working with the Gift of Life that's in Mississippi?
I would love to work with a partner with an organization that promotes life, donate life, and organ donation. I mean, it's just how do I get in the door and you know I want to travel. I have all kinds of people say, "Can you come here and talk?" I want to do a lot of talking in schools. I think that's what I'm going to do this year is go and get in the school system and let these young kids that they can make a difference. You know,
Mhm. The way you get into those organizations is the same way we acquired you, just asking. You wouldn't believe how many doors open if you just ask.
yeah,
Yeah, absolutely. You just call out and reach out to them and let them know
Yep.
what you want to do.
Let them know who you are, what you have done, and how you'll like to help. What you have done so far with your page, and how many people you signed up to donate their organs. You would be surprised how many doors open up with the power of just asking. And if someone says no, no means next opportunity. So it doesn't mean like for you to give up or
Right.
whatever. When I teach my students, I always tell them no means next opportunity.
that's right.
So, do you have a lake on your property?
I don't have much. This what I have here at my place. It'll be just for lodging, and I'll try to get the community involved to share their land and whatever resources they have. We have some public lakes. I live 45 minutes from Grenada Lake, which is one of the best crappie lakes in the world for big crappie. Uh, I mean, our hunting season down here is 4 months long, so we have a long hunting season, and people up north don't get to hunt very long, so they would love to come down here and go hunting
Exactly.
when
And
they're.
people up north actually don't even know much about hunting. I'm from up north. I know nothing about hunting. Nothing.
You're from Pennsylvania. That's one of the huntingest states in the
I
country.
know nothing about hunting. I know about ducking and not hunting. Ducking has nothing to do with ducks.
So Rob, for someone that's out there listening to this right now, who is thinking about maybe donating an organ, but has some hesitation, um, what would you say to them?
Just put it in God's hands. If it's
Mhm.
faith, if they got the feeling, I mean, it's the easiest decision I ever made. I promise you. I mean, when I got on the operating table, I think when I came out or when I was going in, I was laying on my back and I was like I won the Super Bowl. I mean, my arms was up and down like I had just caught a winning touchdown or something. But you know, I mean, I was prepared. If it was meant for me to leave this world on that operating table, I was ready. That's just how I felt about it.
Right.
Were you able to
But I
see
mean,
before you went into the operating room?
do what?
Were you able to see Gil? Were you able to see each other before y'all went into surgery?
I mean, we did. I mean, we went. It ain't like they rolled us in there side by side or nothing, but I mean, we got to say our goodbyes and hug and stuff. And it was I mean, it was a good thing. I mean, I never in my life would see what I'm doing now. Like I say, I never was an organ donor, and my life has changed. I mean, I have this burning dedication to these 9,000 people. I mean, we don't know, but I mean, that's eventually they're going to save lives through organ donation. We never know who it'll be and who will be touched, but and
Well, let me
that's just.
ask you this: who did you have helping you get those 9,000 people to get on the list? Did you have any help with
I
that? Because
don't have.
it seems like
I don't have any help. I'm a one man show.
so you signed up 9,000 people yourself without any help.
Yeah. And it's simply because I don't actually have to sign them up. I just have to get them to my page, and I can see the numbers go up. I don't know who signed up, but I see the numbers. So just say you're 1,000 friends. If you went and invite your 1,000 friends right now, I'm gonna start seeing my numbers go up, and it was because of you. So
Right, but I'm saying, are they actually signing, going in and getting
yes,
it changed to be
yes,
an organ donor?
yes.
Oh wow, awesome.
But still, they need to make it known to their family and have something else. But yes, that does sign them up to be an organ donor.
Yeah. They have to have it on their license
And
because
even on their license, sometimes they don't. Family doesn't carry that out.
right,
You,
but
you know,
that's that's where mine was at when I thought that I could be a kidney donor or someone that could donate life to people. I can't. Not my kidneys, probably not even my lungs. Maybe just like my eyes or something like that. But
I didn't even know that after my transplant, I didn't even know there was such a thing as a lung transplant. There's
yeah,
people out there that don't even know you can donate a kidney.
yeah,
You
that's
know,
why it's so important. Like education is so important. We stress
It is.
education, 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 education. Because without knowledge, there is no power. So you don't know anything if you're not taught, if no one is raising awareness, if no one is teaching it. And they don't teach what we just learned about people donating organs, that there's grants out there, that there's monies to help you get around. I had no clue. I've been working in dialysis. This year is my 19th year. I had no clue.
So, Rob, tell us about that grant. Do you know the name of it and where you can apply?
That was all handled through my hospital, and I had to do it like you have to do it prior to transplant. And, they just, it's real simple paperwork to fill out. And I think most people get it. I'm not sure, but I mean, I wasn't able to. I mean, if I hadn't got that grant, Gil would have had to pay for my expenses or his family. I wouldn't have been able to pay for it.
Wow.
I just kind of done it.
Well, I thank God that those grants are available. I hope they're at every hospital.
It's a national grant.
Oh, okay, great.
Mm-hmm.
I mean,
I'm gonna find it and post it and let people know
and
this grant is
I
available.
mean, I have my transplant at KU Med Center. You might call them and you might Google it. I'm not sure, but I mean, it is a grant out there, and it's up to $5,000 as a limit, and it'll cover travel expenses, mileage. I mean, up to $5,000, and you could spread it out up to 2 years on your follow up visits or whatever.
Wow.
Uh,
So, how have your follow-up visits been since the transplant?
do what?
How have your follow-up visits been since the transplant?
Well, I donated. I'm way past I don't go to the doctor anymore, but I had 2 years that I had good visits, and I'm good, and it's been 6 years. This November it'd be 6 years since our transplant. Uh,
Right,
I
but I
was
still think you should go to the hospital and always make sure that your levels are good. Your
I'm
G,
not big on hospitals, and now I don't have any insurance, so I don't. Even when I had insurance, I couldn't afford to go to the hospital. So, but
do you guys
uh,
have a free clinic out there?
I doubt it. Ain't nothing free, not when it comes to medical stuff.
Hmm.
But I'm good.
Okay.
Okay,
And also I after I donated my kidney, I actually got to go through the process of. I was actually married when I donated my kidney and started Forever Outdoors, but we got divorced. But later on, I met a girl in my hometown. We actually the same age and never met each other. And I was promoting Forever Outdoors, and she was needing a kidney, and her mom had just read a story about us, and I put her photo on Forever Outdoors page. She was needing a kidney, but eventually her friend donated her a kidney. By then, we had started dating, and her name's Cindy Pittman, and so I actually got to go through her receiving a kidney, and
Wow.
it was pretty neat to see that side of it. I was actually getting to see what I'd gone through.
Right. So I'm about to address this viewer. It is a shame that he doesn't have any medical coverage, especially after he donated a kidney. I feel like they should make sure he had medical coverage even now. What do you think?
oh, absolutely.
Even when
Because
you receive a kidney after 2 years, folks get cut off from their insurance, and the insurance is so bad that they can't. I mean, you might get dropped from your insurance and you can't afford your anti-rejection medicines. I mean, after 2 years, you get cut off.
and you're absolutely right, Rob, and that's one of the concerns that we have for people who may be in a situation
Hello,
that can't afford it.
Right.
Can you hear me,
you
Rob?
there?
Yeah, we're here.
Can you hear us, Rob?
I can now.
Okay, great.
Okay.
Great,
Now,
great.
what I was saying, Rob, is you're right about that because some people, especially in urban areas, who may get a transplant after the 36
Hello,
month.
Steve. You're froze up.
Hold up, Rob. Can you hear me, Rob?
I can.
Okay.
I'm
So
here. You hear me, Tamika?
Steve is there. So sorry guys, but we are live, so sometimes these things does happen. Just like bear with us as we work through them. Thank you. Yes, Steve is there.
Yeah. So Rob, can you hear me?
No, he can't hear you, but Steve is talking now, Rob. So I'm gonna
Yeah.
let you
Yeah.
know.
Ask him. Is he taking any medicine from the since the operation?
So Steve wanted to know, are you or have you took any medicine since the operation?
No, not
No,
really. No, I'm not. I'm not on any medication.
you're not on any medication. I'm going to look up in your area to see where there's a clinic at where you could possibly go without having insurance. It's so important that you take care of your body so your body will take care of you.
Yeah,
Especially since,
one kidney.
yes, and you need to make sure that your GFR levels are well, okay? Even if you're having no symptoms, that's why kidney disease is a silent disease.
Oh, yeah, I agree. We got to take care of ourselves. I'm just not a
Yeah,
big on going to
don't
the
make me have to
doctor.
come
Never
down
have
to
been.
Mississippi and drag you to the doctors. So, we have a viewer with a question. What do you mean about getting cut off? I'm about to post his question in 1 second. Okay. So he means about getting cut off of medical. That's what he means about getting cut off. Explain it, Rob, about their medical insurance.
After 2 years after a transplant, they can cut the insurance can cut you off, and you can if you don't have enough money to buy your own insurance, you just might be out of luck. You know, uh,
Is that something down there?
if you can't afford to be on disability, and they say you can go back to work, and uh, after 2 years, that's it on a lot of people. I mean, they'll pay for you to be on dialysis forever, but they will not pay for your anti-rejection medicine forever. They won't pay for you to be on your anti-rejection medicine forever.
True. Steve wants to answer this question. Go ahead, Steve.
Say that again.
You wanted to touch on this question about getting cut off?
No, no, no. It was something else, but I forgot.
Okay. Well, we're live and we're human, so we forget. There's another question up there about it says, Medicaid says that you're no longer disabled after 3 years of a successful transplant.
Do what?
Medi- Medicare says that you're no longer disabled after 3 years of a successful transplant.
Is it three? I thought it was two.
Well, I guess different places have different. I don't know. I'm going to have to look
Oh
too because
no,
I thought it
I
was
think
2 years.
the person Dawn, she would know because she
It
told
may
me
be
that.
3 years, but 2 or 3 years.
Okay.
Yeah,
Okay. You have.
it's
Go ahead,
three
Steve.
years.
Okay.
And the
Yeah.
thing about it is, Tamika, is
Mhm.
that how can you say after 3 years that you may not have any problems if you can't afford that anti-rejection medicine?
And not just that, some people have other issues besides renal failure.
Okay. You see what Don said that you had to have a secondary health
Very
plan, which
excellent.
becomes
Mhm.
primary.
Wow. But I bet you a lot of people don't know that getting these transplants.
Did you know that, Rob? Tamika, ask Rob if he knew that.
Rob, did you know that about the secondary health plan, which helps you become primary after you get your transplant?
Do what now?
Did you know about having a secondary health plan, which helps you become primary?
What for me as a donor?
No, for the recipient.
I'm not sure.
I'm not sure. I don't think there's any special medical plans for donors. It should be, but I don't really think that it is.
No.
Ask him, did his insurance take care of it through this firefighter?
Did your firefighter insurance take care of it? I don't think so, Steve, because he resigned from his job.
But
But
that
that was way after. But I mean, I got bills in the mail, and I just had to forward them to the hospital. But it was, I mean, it was a pain. But I guess they took care of all of them. You know.
Right. I think that the donor should get compensated some type of extra medical benefits if
oh,
they,
absolutely,
you
absolutely.
know, it's just like when the vets come home from war, they should not be out in the streets begging for food or begging for money. Like the government should compensate them more than what they do. I
Yes,
don't,
I mean, it would probably help encourage people to become donors. You know, if, I mean, not that that's the reason they would do it or anything, but you know, I mean,
I
it
think
is a big sacrifice. I mean, it is a big sacrifice, and I don't have kids, and a lot of people won't donate because what they say, what if my kid needed one or this, that, and the other? And I mean, I understand that, you know.
right, but sometimes you're not a match for your own child.
And there's people that don't even donate for their own family members, you know. Uh,
Like,
And that's big. I mean, that's a big. Tell them that's a big decision to make. I mean, some people, probably not ready to do that, or be put, um, you know, um, in
low.
a corner like that. You know what I'm saying?
yes, Steve's talking. Yeah. The donor pays nothing if the recipients. Oh no, I'm reading a question. I'm going to post this question. I'm still shocked that you don't have any medical coverage. They should have some type of free medical coverage for you in Mississippi. Like there's some type of Medicaid you can get. I know there is. I'm gonna find out because you need to be seen. I don't want your levels to drop and you wind up in stage 3 of kidney disease when it could have been prevented if you'd have knew ahead of time.
Do y'all? We haven't talked about kidney exchange pairing program. I mean, I didn't know this till I went through this with Cindy, but you know, if you have somebody that needs a kidney and you're not a match, you can still be a donor and somebody else will donate, and it just creates a chain of people receiving kidneys. Um,
Yeah. And they have that where you're at too, right?
yeah,
Okay, awesome.
Yeah.
Cindy still have her kidney?
she does. She does. She's doing good. She's been out since 4 years. She's 4 years out.
Okay, awesome. So we're about to bring in one of our other co-hosts for the next 5-10 minutes, Jermaine Fingers. I'm gonna bring Jermaine and Steve.
Okay. I haven't seen them in a while.
I know, right?
Hey guys.
We look like the Brady Bunch on here now, guys.
All right.
So this is the first time we ever had 4 people on one live at the same time. This is awesome.
I don't see her,
It's a guy. His name is Jermaine Fingers. Go
Jermaine.
ahead, Jermaine. Well,
Hey, how you doing?
Hey, what's
can you
going
hear
on,
me?
man?
I'm good. Just got out of
I
football
see him on my
practice. Got to take
computer.
a camp.
Okay. Can you hear him, Rob? Can you hear Jermaine?
I cannot.
Me neither.
Yes.
Oh.
Wow. So no one can hear you. Let me take you out and bring you back in. Let's see what's going on. Once again, this is live feed, so we go through some things, but we work it out. Thank you for being patient with us. She had surgery at the same hospital. Jermaine,
Yeah, I can hear you. I don't think they can, but I know I can talk through you.
You okay? You can talk to me. All right.
Yeah, yeah.
All right. So Jermaine, he can hear me, but y'all can't hear him. So
But I
He
can hear
just
Steve.
disappeared.
I can hear Steve and the special guest. But I can talk through you guys though. They might not can hear me, but I can talk through you guys though.
all right. So he can hear you guys, but you guys can't hear him.
Right.
Gotcha.
Got all right.
So what's going on, Jermaine? How's everything?
I'm doing fine. Just got out of football practice and stuff. I see you guys are
You
talking
heard me.
about kidney donations when I got on board. As you know, Tamika, that I'm going through my final stages of getting a final testing of getting transplanted at Jewish
What you say,
Hospital in Louisville.
Tamika?
He said he's getting his final stage of getting a kidney transplant. Well, basically being on the list, being on the active list. So he's going through testing, the stress test, and all that stuff.
Yeah, this would be my second.
Okay.
This would be my
Can
second.
the audience hear him?
Yeah, they probably can hear me.
Yes, they hear everything.
Yeah.
This
Okay.
This would be my second transplant
okay.
team. So I will be basically on two lists, and I got a donor, so he's going through
Yeah.
the testing as we speak. So
What is he? What is he mentioning?
So he's saying that he's on two lists, and the guy will be donating soon. Is that it, Jermaine? Is he going to?
yeah, he's going through the testing now
Okay.
to
But
see
you
if
got to
he's
get that blood pressure down.
a match and stuff, and if he can handle it. So I'm keeping my fingers crossed.
Well, before you cross your fingers, you better get that blood pressure down, sir.
You know what I have?
Speaking of blood,
Do you have someone that's a match?
speaking of
If
blood
you
pressure, Rob,
uh
have you had
tell
any
me
blood pressure
that,
issues?
One
he's gonna
second.
tell me if he doesn't match, he will be we'll do he could be in the exchange program.
Right. So 1 second, Rob, have you had any blood pressure issues?
Uh,
Rob hasn't been to the doctor, so he doesn't know. But I'm going to work with Rob. You're going to have me come to Mississippi with all this attitude and take him to the doctor, drag him to the doctors because he really needs to get checked out. He doesn't know where his blood pressure is. He doesn't know his GFR rate. And I think with
Wow.
one kidney is very important.
Yeah,
No,
yeah,
hell, it's
it is important.
imperative that he knows his numbers.
Yeah, I'm surprised none of the doctors or the people from where he donated, nobody followed up with him. They hyped it up. He had the transplant. It almost seemed like they forgot about him.
No, they just don't care anymore. Next patient, next patient. So
Mm-hmm.
he's no longer a factor. The kidney transplant was successful. Once it's a success, whatever, they don't care like that. They're not going to follow up with him because
Right.
they
No,
don't.
it's up to the it's
do
up
you
to the
have any
transplant.
complications up to 2 years that they cover? But
Right.
after that,
It's up to two
After
years.
that, they're on their own.
So they don't care like that, Steve. You know, medical health. They don't get me started. They don't care.
they
I
don't.
mean, they when I was
So
a
ask
Jewish,
Jermaine how many more tests he got to go before he's a
I
go.
was actually just went to. Can I speak now?
tell
Yes,
them
go ahead.
one.
I was actually just up in Kansas City last month, and I actually got to go by the hospital, and I visited with a bunch of transplant nurses and stuff. It was pretty cool.
Yeah, next time you go, have them take your pressure.
Yeah, I can go get my blood pressure checked
Do
somewhere.
that. You need to go get your blood pressure taken somewhere, just so we know what your blood pressure is.
Yeah.
You just got a big sister, and then I'm gonna be riding your back.
Tamika, tell Steve I only got one now.
Ask Jermaine what step in the process that he's in before he's a go.
Okay, Jermaine. What's the next step you have? How many
I
more
take
steps wants to
I
know?
take my last test is at Jewish Hospital in Louisville. It is a stress test,
I don't
and it's
think he can hear you.
Yeah, it's a stress test, Steve.
And that's it.
It's
yes.
Yep.
All right. All right. That's
So since you doing a stress test, you need to start walking around the block and stuff like that. Like start conditioning your body.
mm-hmm.
Tamika, I've been conditioning my
That's
body every day since July 10th.
I'm sorry.
I've been conditioning my body every day since July
Good.
10th.
Good. Because they don't tell people when they have people go for stress tests, they don't tell them to start exercising and stuff like that. So when they go for the stress test, they wind up getting denied because their body's not even active. So you have people that don't think they can move because they're on dialysis, and all of a sudden they want to say, "Oh, I'm gonna go get a transplant. So I'm gonna get on the list." And they don't move. They don't do any type of movement. So they go get on a treadmill or whatever they put them through the stress test, and they fail, and then they can't get on the list
And that's
because no one told them.
yeah, that's where Joe Bueno out of South Carolina comes in at because he's a transplant coach
Hmm.
and
Tamika, I'd like to mention something about transplants also.
Yes, this is so weird. Go ahead.
I grew up, my friend's bus driver, we grew up together and rode the same bus. His mom drove a bus. Well, anyway, he needed a transplant, and actually, he just passed away maybe a few months ago. But he was stubborn, hard headed, but he couldn't get a transplant because he wouldn't quit smoking.
Oh, yeah. I'm sorry to hear that. But yes, you need to stop doing a lot of things to get a transplant. You're going to compromise that kidney.
mm-hmm.
Yeah,
Mm-hmm.
that'll do it for you too, man. You
Yeah.
won't start smoking.
Absolutely.
That's one thing they stress.
Yes. So before we end the show tonight, it is 10 o'clock. We do have an hour-long show. I just want to thank our guest, Rob Robertson, for joining us. Like I said, in the next couple of weeks, I'll be working with Rob to get a campaign started to help raise money to get the campaign he wanted and the oh my goodness, out forever outdoors to be the way that he wants it. So like I said, I've been up since 2:45, so y'all have to excuse my memory, okay?
All right. Okay.
All right. Thank you again, Rob. I'll be calling you. I'll be harassing you. Um,
Okay, I appreciate it.
yeah. And thank you, Jermaine, for popping in on us. We need to
Oh,
get
no
him.
problem. Tell Steve to call me.
Yeah, absolutely.
He can hear you. He gonna
And now
call
you
you.
hear me.
Huh?
We have one more question. We're going to answer one more question, and then we are out of here. Uh, Anthony says that he's never heard of the stress test where you run on a treadmill. And hold
There's types.
I'm sorry.
There's two types. There's the treadmill test,
Mm-hmm.
and there's the actual medicine they put in your veins. You gotta
Right.
tap it out. I call it the tap out test.
Yeah. So each facility may have something different, but it all does the same thing.
Exactly.
And how strong your heart is to be able to go through the process of getting a donation. So
Absolutely.
join us next week with another guest. We thank you all for joining us. Thank you for laughing with us with our little bloopers because this is a live this is a live feed show. So we do have some technical difficulties, but we keep the show moving.
Absolutely.
We'll see you guys next week on
Rob,
Urban
thanks a
Renal
lot
Talk.
for being on, man. We really appreciate you bearing with us for the last two Thursdays. Look
Thank you.
forward to working with you.
Yep. Everyone take care and God bless.
All
God
right,
God
see you.
bless.
bless.
Good
All
night.
right, bless night.